Good morning, afternoon, and evening, everyone. My name is Diva, and I'm a Senior Program Officer for Gender Data and Evidence at the Gates Foundation's Gender Equality team. We're here today for a panel on the legacy of COVID-19, mobilizing gender data to deliver better science. And as soon as I can move my slide to the next one, that would be good. We know that COVID is gender blind, but it's not gender neutral. Women have been disproportionately affected by the pandemic, whether it comes to livelihoods, unpaid care work, mental health, or violence. Unfortunately, there has been a lack of reliable, quality, and granular data to consistently track and understand the impact of the pandemic across geographies and across periods. In response to many of those data gaps, as well as associated measurement and data collection challenges, many of our experts here today have been thoughtfully and actively developing and mobilizing tools and solutions, developing innovations to fill those gender data gaps in order to actually help shape responsive gender policies. Today, you're going to leave with an understanding not only of the key gender data gaps related to COVID, but also insights, resources, and specific recommendations for researchers, practitioners, and governments on how these gender data gaps should be filled. It's my pleasure to introduce our 4 expert panelists today who are going to be speaking on diverse topics from sex-disaggregated data and insights on COVID, innovations in gender measurement, advanced methodologies for gender data, and moving from gender data to gendered policies and impacts. Our first speaker today is Sarah Hawkes, who is the co-director of Global Health 50/50 and professor of Global Public Health at the University College London. Our second speaker is Anita Raj, who's a professor of medicine and education studies, as well as the director of Center on Gender Equity and Health at the University of California at San Diego. Thirdly, we have Amy Heng, who is a professor of global health at Duke University and also a member of the board of the International Biometric Society. Last but not the least, we have Papa Sek, who is the chief of the UN Women Research and Data section. We also have a number of response panelists who will be speaking following the lightning presentations from our panelists, who I might remind you all should not exceed 5 minutes. Also, just given the short period of time, I'd like to request that people participating today please put in your name, affiliation, as well as your priority area of interest on gender data. And please feel free to also ping us with questions, especially with the name of the panelists you would like to direct them to. And so without further ado, I will hand over to Sarah Hawkes.
Thank you very much indeed, Diva, and many thanks to the organisers for the invitation, and also, of course, Diva, to you for you and your colleagues at the Foundation for the support that's made this presentation possible. So I am presenting on behalf of Global Health 50/50 and our partners at the International Centre for Research on Women based in New Delhi and the Africa Population and Health Research Centre based in Nairobi. If I could move on to the next slide, please. Essentially, thanks. For the last 18 months, we have been collecting as much sex-disaggregated data on the clinical pathway of COVID as we are able to find, produced by national governments. So the data that I'm about to present to you is purely from national ministries of health or national statistical offices, and it relates to COVID as it affects men and women differently in terms of exposure, and health-seeking, healthcare experiences, and health outcomes in as many countries as we are able to find data in. So the 3 partner organisations have been working together for about the past year, covering now 204 countries in the world. And we look at data every month, the data that's published at national level every month, along various points in that clinical pathway that I've just set out for you. And the reason that we do it is because we think that it's really important to understand sex-disaggregated differences in terms of both how we identify questions for further research, how we identify clinical guidelines or health policy guidelines or programmatic guidelines that respond to and try to reduce difference. So what you see on this slide are the very clear points along the pathway where we find data. And just to say that in the year and a half that we've been looking at the data, we've only found very minimal national data that is not presented in a very binary way. In other words, we find data referring to men and women or to males and females. We've only twice found data from national governments that refers to people along the gender, the wider gender spectrum, taking into account that, of course, gender is not a binary, includes people with non-binary identities, people with transgender identities, but that none of that that's hardly ever reported by national governments. So if I could move to the next slide, please. So this tells you what we found cumulatively over the 18 months that we've been reporting on this data. And one of the things about this data set is it's remarkably consistent. At global level, we've seen very little variation in these kinds of outcomes. And the sort of, I guess the key message is that in terms of diagnosis of cases, we see an almost equal distribution between men and women. In terms of who goes and gets tested, we see more women than men getting tested. We see a lot more men than women being hospitalized, and particularly being hospitalized with disease that is severe enough to require admission to intensive care. And consistently since the beginning of the epidemic or pandemic, we have seen about 30% more men die than women die. So if I can move to the next slide, please. What we're able to see, in addition to that sort of simple binary disaggregation, is we're able to analyze the data according to the context in which it is collected. We can't do a huge amount of analysis, but we are, for example, able to look at analysis by the income level of the country or by the gender inequality index of the country. And we start to see patterns that start to explain why we're seeing the differences that we see. We also see regional differences around the world, very much dependent upon the economic and gender equality measures of countries at aggregate national level. And if I move to the final slide, what we will see on the final slide is what we can do with the data. So on the left-hand side of the slide, what you see is data on testing. And you'll remember that at aggregate global level, we saw more women than men going and getting tested. That stayed consistent at about 25% more women getting tested than men. But what we've also done is look at how policies and programs respond to that evidence. And so we've analysed data policies from 75 countries. We've analysed them along the continuum of 6 policy points responding to those data points that I showed you. This, on the right-hand side, you see the evidence relating to how countries respond to gender differences in testing policies. And essentially what we see is, despite that 25% gap, the vast majority of policies in the world that we are able to analyse completely overlook gender in its entirety. They simply don't mention gender 90% of the time. So the bottom line is that we've got plenty of evidence to show that COVID indeed has a gender difference in terms of how it affects people according to their gender identity, but policy and program responses are predominantly gender unaware and gender blind. And thank you very much for this opportunity again, Diva.
Thank you, Sarah. And I would now like to invite Anita to start her presentation on innovations in gender measurement.
Thank you. Thank you very much for inviting me to participate in this. We're very excited to share with you some of the work we've been doing on the eMERGE project in regard to measurement. The eMERGE project is a project that focuses on building the evidence base for measurement that can be used to focus on the issues of gender equality and empowerment. So while this platform is really, it was developed prior to the pandemic, and it was really designed to be expansive in its focus on creating global open access to measures in this area. It also positioned us to be able to be rapidly responsive to the COVID pandemic with a gendered lens. Next slide. So I'll talk a little bit about what we've been doing with regard to our response to the COVID pandemic. What we really focused on, and this builds from the last presentation, was gender disaggregated data with regard to what we view as secondary effects. There's a variety of ways that we really focused. We were thankfully, happily funded by the Gates Foundation to look at this from a global perspective. We also received some funding from Kaiser Permanente and Blue Shield of California to look at it within the context of the U.S. We were focused on a variety of issues. So the very first thing was we looked at the literature as it was coming out rapidly, to understand what the gender dynamics were, and we were looking at it with across a variety of areas with regard to secondary effects. These included other health effects, so not specific to infection or complications from infection from COVID directly. So this could be any kind of physical or mental health. We looked at gender-based violence. We looked at household burdens and that distribution, and we looked at financial issues and employment and entrepreneurship, and we looked at women's leadership and positioning, including that within the health sector, which we know that women disproportionately are represented among healthcare workers, both formal and informal. Next slide. And so one of the things we did, and it was very rapid deployment, was we realized that there was really a gap in the nature of the measures that were available to help people focus on capturing these issues with an eye towards the COVID pandemic and how things, one, were affected by the pandemic directly, and two, what was sort of the change or the shift from pre-pandemic during things like lockdown and subsequent. And we looked at this in a variety of areas. We created these modules that you see here. This is on our eMERGE website, emerge.ucsd.edu. We'll put it in, we'll make it available to you all. And what we did from that point was we made that open access freely available across the globe. This became our most commonly visited page on our eMERGE website, and we could get sometimes up to 100 people coming to visit it within just a few day period, less than a week period. So what we know is that it was deployed out across the world. We saw it in high income, low income countries, low and middle income countries, but we also funded or supported with technical assistance the deployment of these modules across 23 country sites. And to that end, we have a few preliminary findings we'd like to share. Next slide. So these are findings that have come out in just the last few months in formal presentations and peer-reviewed publications. This one is one that is focused on India in Pune district, which is a rural area of Pune district, which was an area hard hit by the pandemic and early hit by the pandemic. So a few findings. Number one of the most consequential health impacts of the pandemic has been mental health. And that includes depressive and anxiety symptoms. And we know that that is disproportionately affecting women. This study further found that 2 of the key risk factors were financial distress, job loss, as well as having someone who was directly infected in COVID in the household. These equivalently affected men and women. However, interestingly, if you accounted for social support and government support, you saw a greater attenuation of these effects for women. So we know that men may be more vulnerable to not having these supports affect them. We're also seeing increases in violence, physical violence, and cyber sexual harassment in the context of the US. And we're also seeing, while there's disproportionate and increased burdens for women in the healthcare workforce and women political leaders, we're seeing growing respect for those women. So we're seeing some really important findings that may have long-term effect. That is my presentation. Thank you so much.
Thank you. And over to Amy Heng next to present on advanced methodologies for gender data.
Thank you so much. It's been such an honor to be here so far and hear about all the wonderful work that's going on. And as a statistician teaching global health statistics, I'm always excited to see accessible data, such as the gender data portal and other things that people have worked so hard to make available. So today I just want to talk from the perspective of statistical methodological considerations. And to cut to the chase, the main argument I guess we have is that data collection by default should include sex and gender. So to try to change and implement a mindset where this is just a standard part of data collection protocols. Some areas we do better jobs in than others. And we can just go to the next slide now and talk a little bit about why. So data collected today for one purpose are often used in the future for other purposes. And it's very difficult for us to anticipate how data might be used down the road. The value of data we're collecting increases the more we can use it to answer interesting questions. And so organizing data by sex and gender greatly increases its current and potential value and potential uses, and it will reduce in the long term the overall expense of data collection. If we have to try to go back in time to track down data, this is very expensive in terms of time and in terms of money, and also quite error prone. And we hate to get at that down the road point in time and find out, oh, if we only had good data on sex and gender, we might be able to control for this bias that we know is inherent in the data. In addition, data availability by sex and gender is necessary to assess progress towards the majority of the UN Sustainable Development Goals. Next slide. So as a statistician and data scientist, one goal in any analysis, whether it's focused on sex and gender or not, is that we need to be able to control for sources of variability in the data. And sex and gender are large sources of variability across very many domains. So for example, we heard Sarah talking about COVID and how we've seen that men are less likely to be vaccinated, more likely to be hospitalized, more likely to die. Heart disease is another example in which the risk factors and even the symptoms vary greatly across biological sex. Next slide. Interoperability of data sources is threatened when sex and gender are not always available across multiple sources that we'd like to combine. Many of the algorithms that are in use today, machine learning and artificial intelligence algorithms, have been shown to be biased by sex and gender. And if we're to be able to correct or control for such biases, we need to have data on sex and gender readily available. And that's a really key concern, is that we need data to be available and accessible by these two variables. Obtaining unbiased sensitive data, though, by sex and gender requires really thoughtful design of interviews and data collection. And I don't want this point to be de-emphasized. So, questions about sex or gender may be addressed by pulling them from administrative records. I've seen surveys where the interviewer is told to note the sex and gender of the interviewee. Even when the respondent is able to provide this information directly, sometimes times the interview is not happening in a private setting and the respondent may not feel comfortable responding. So this point is really important and that we think very carefully about ways to get the highest quality data we can. That's all I have. Thank you.
Thank you. And I'd like to invite Papa Sek now from UN Women to talk about moving from gender data to gendered policies and impacts.
Thank you very much, Diva. And hello to everyone. Greetings to everyone. So nearly 1 in 3 women is confronted to physical and sexual violence by an intimate partner or sexual violence from a non-partner. A human rights violation of pandemic proportion that preceded the COVID pandemic. And during COVID, administrative data proved to be precious to assess service availability and accessibility, but could not inform on the magnitude of the impact of COVID-19 on violence against women. So to inform plans for data collection during lockdowns and restricted mobility periods, UN Women and the World Health Organization produced a global guidance highlighting the importance of ethical and safety considerations. And the same considerations on women's safety, especially for true and rapid and remote data collection. And given these methodological concerns, the UN Women, with the support of the Gates Foundation, decided to further work on the successful implementation of rapid gender assessments in 57 countries and to test those same methodologies focusing on violence against women-related questions. Next slide, please. And in conducting violence against women rapid gender assessments, we collected data in 3 ways. First and foremost, we collected information on how to remotely collect data in violence against women on violence against women following ethical and safety protocols. Thus, in implementing RGAs during the pandemic, we coupled it with innovations in survey tools. As respondents may not share personal and direct sensitive experiences, we experimented with indirect questions through list randomizations and vignettes. The survey protocols tools were also implemented following strict protocols to ensure safety of the women as listed on your screen. And applying these protocols, we are now in the process of producing new and much needed data on violence against women for 13 countries. We will be releasing these estimates next month on the margins of the 16 days of activism against gender-based violence. But more importantly, we are also collecting the data on how these results are being used. We are thus closely engaging with our national partners and communities as we aim for the survey results to be used to improve existing policies and programmatic gaps on violence against women. In fact, as the first step, the surveys were implemented only with the authorization of national statistical offices or ministries of women in order to promote ownership, uptake, and use. Next slide, please. A demonstration on how we have been collecting data on use cases for the rapid gender assessments we've been supporting is here on your screen. And moving from gender data to policies and impact. For example, in Chile, the RGAs that we conducted helped create a subsidy program to support women caregivers. In Maldives, nearly 7,500 women, informal women, were now included in the government's income and support allowance. Similarly, in Jordan, UN Women is using the resources to better ensure remote gender-based violence services and support. Similarly, we have similar results in Senegal, in Albania, and other countries, just to name a few. And the RGAs on violence against women will follow that same script. Essentially, we are exploring ways on how these initial results could inform gender policies. In Thailand, for instance, initial results are planned to be used in lobbying the government for the passage of the Anti-Violence Against Women bill. And in Kenya, we are working on the RGAs on violence against women results to contribute towards the implementation of the programs of the President's commitment to build strong data and evidence to inform policies and programs. So UN Women will be using these and other advocacy platforms to really ensure that the data is used to inform policies. And for the last slide, please. again, we are following this same approach in our work. We are increasingly shifting from our perspective from data production to data use, and just ensuring that the bridge between the two can really be addressed. Thank you very much.
Thank you, Papa. Thank you to all our panelists today. What we will be doing now is just moving over to a few of our discussants, our response panelists, in terms of their comments on and observations on the presentations we've heard today. They will be responding for about 3 minutes each. I'll just briefly introduce them. We have Damaso Kadenge from the African Population and Health Research Center, where he's the head of data measurement and evaluation. Abhishek Singh, who's a professor of public health and mortality studies at the International Institute for Population Sciences. And he's also been recently appointed as the new director for a division in gender demography. We next have Linda Laura Sabadini, who is the central director at ISTAT, the Italian Statistical Institute. And finally, we have Ilaria Kapua, who is the director of the One Health Center of Excellence at the University of Florida. Damaso, may I invite you to give a few comments and observations based on your experience and insights on gender data from the presentations we heard today.
Thank you, and thank you so very much, Diva, for the invitation. I think very nice presentations out there from the different panelists, but I think the key question that comes to my mind are the processes behind how we get this data, what do we go through, and then after we got this data, then what next? So when I think through, and especially based on our experiences collaborating with the different partners, the fact that there are some more questions than actually the answers. So for instance, we have data that we have countries that are not reporting COVID disaggregated data. So the key question is how do we go about that for those countries which are not reporting this data, mainly because some of these COVID-19 data have been politicized. So how do we go about that? Then there are also questions to do with inconsistent definitions and indicators across different countries and from time to time. But at the end of the day, now we know that we have some data in our dashboard. We want to ask ourselves some two important questions. How do we improve the use of the evidence and the data that is generated so far? And the other question that comes to my mind is, how can we continuously engage policymakers and advocate for open data sharing at the country level, at the regional level? So those are some of the key questions that we might want to think about based on some of the findings and the presentation that we've had so far. So back to you, Deva.
Thank you. Abhishek, may I invite you next to offer a few comments?
Thank you, Deva, for giving me an opportunity to be part of this important panel on gender data. And I would start by saying that gender data are limited in low and middle income countries, including India. But at the same time, I feel that there is a felt need for gender data, and India is not an exception. I will give you some examples of what is happening in India, what changes have happened recently. And in India, different stakeholders have recognized the importance of gender data for informing policies and programs related to a number of issues, including but not limited to financial and digital inclusion, family planning and reproductive coercion, healthcare access, physical and mental health, time use, etc. And these data have become all the more important at the time of COVID-19 pandemic, as some of the speakers have already highlighted. And one of the primary source of gender data in LMIC, and that also applies to India, is the large-scale household surveys. Now, these surveys are often overburdened, and hence they collect limited gender data. And in addition, another challenge that these surveys face are that they provide gender data at few administrative levels, like the national level and the state level. So if we are really interested to go below that, for example, for a country like India, where states are too big, in that case, getting gender data at the lower levels are difficult. And one such key source of gender data in India is NFHS. And I'm mentioning about this because currently India is planning to start the 6th round of National Family Health Survey. And there are demands from various stakeholders to include questions on digital and financial inclusion, time use, menstrual hygiene, marital choice, reproductive coercion, safety in public places, etc. And I am happy to inform that there is a general consensus among the NFHS team and the expert panel, which is constituted by the Ministry of Health and Family Welfare to decide what information needs to be collected. So there is a consensus between the team on inclusion of a majority of these items in the 6th round. But the major challenge is how to frame questions. How should we ask these into the field? So maybe from this week, next week onwards, we are going to debate on these issues, and we definitely look to, Anita and others who can really help us in, and others also who are working in gender data to advise us how to actually and how to include these questions into the survey, how to implement these into the field setting. Now, you also just now, Deva, you also mentioned that I have been appointed as the director for Center for Demography of Gender. So you can imagine that there is an interest. Ministry of Health and Family Welfare, Government of India recognize the importance of gender research and gender data. And that's why they have opened this new center at the International Institute for Population Sciences. And they have given us a mandate to do more high quality research on gender issues in population and development, and also to collect, compile, interpret, and share such data and findings with the Ministry of Health and Family Welfare, Ministry of Social Justice and Empowerment, and so on, so that better and informed policies can be made related to various aspects, including maternal and child health, COVID, and others. So at the end, I would just like to say that attempts are being made. I can say with confidence for India, attempts are being made to collect gender data on a wide range of issues. And I am also confident that India would be able to fill some of the existing gaps in gender data soon. So we look forward to these new data sets that will be available for all, including the researchers and policymakers, to look at and to see if and whether there have been changes in the gender indicators over time. Thank you, Deva.
Thank you, Abhishek. We know how crucial some of the data sets that NFHS provides are, not only for gender, but for many other insights for India's health and development. I'd like to pass now to Linda Laura Sabadini.
Yes, I want to start from an article of Nature. In the first phase of pandemic, as pointed out by this article, the studies that have been developed and published in scientific journals are 4,500, and only 4% explicitly report a plan to include sex, gender as analytical variable. And 21% address sex, gender solely in the context of recruitment. And just 8 of 45 COVID-related clinical trials published until December 2020 report sex-disaggregated results or subgroup analysis. The majority doesn't mention this variable, and gender, this analysis is neutral in the study, and these results are very negative because neglecting gender doesn't allow us to give ourselves tools to reduce inequality, to develop targeted prevention action, to modulate the action to be taken in crisis situation such as the pandemic, but not only pandemic. It is a very serious signal that cannot be ignored, and I think we it's important, it will never have to be repeated. We need gender data by default. The second thing I want to underline is that official statistics have a fundamental role, a fundamental duty to play their part on this front. And we in Italy have tried to put it into practice during the pandemic. And during the first wave of the pandemic, in collaboration with the Ministry of Health, we conducted a seroprevalence survey to measure the actual spread of the contagion, the number of asymptomatic cases, but also to verify the actual existence of gender and social differences. The mortality rate showed that men were more affected than women, but the survey showed that there are no gender differences in the spread in contagion, and the risk factors were represented by territory, the northern regions, in particularly Lombardia, by the citizenships, because the foreigners were more affected, and especially by living with an infected family member, and that controlling for other variables such as employment, economic activity, smoking habits, chronic disease. It was very important. So we must be careful, because producing gender disaggregated data means producing quality information. And so it should be in all the statistics domains. Gender is a fundamental aspect of quality and is not a topic. Thank you.
Thank you so much, Linda. And last but not the least, I'd like to invite Ilaria to give her comments and observations before we turn to the Q&A. Ilaria, are you there? You're on mute.
I'm sorry. Yes. Hello. Good morning and good afternoon to everyone. I am a virologist, and I spent most of my life working with pre-pandemic viruses. So working with viruses that may become pandemic. And so I was one of the few people who was actually certain that a pandemic was going to happen. This pandemic has been, of course, is a transformational event. And I think that it is clear that it is an extremely pervasive event. The objective of the virus is to infect as many people as it can. It doesn't matter whether they're women or men. And you know what? Among the unpreparedness that the world arrived at the pandemic with, there was another major unpreparedness, and this was the fact that nobody had actually imagined that there could be such a big difference between what was happening in men and what was happening in women. And I don't think I need to repeat what has been elegantly mentioned by the people who have spoken before me. This is different. Not only from a biomedical point of view, it is different from a social point of view, it is different from a response to the pandemic point of view. And of course, it is different with reference to burden, because women have suffered the greatest burden. And as a utilizer of data, I have realized to my total astonishment that when you buy data or when you look for data, they are not disaggregated by gender. And if you want data which is disaggregated by gender, you should ask for it or you should pay for it. And I think that this is totally unfair, of course, but it is totally unreasonable because it is under the eyes of everyone how many differences there are. And if we really want to support women and we want to support their life, their livelihood, and their role in society, we cannot do that if we do not have sex and gender data, which is disaggregated. And so to conclude, I would like to say that we need policies that make this possible. So we need to support a data provision which is disaggregated by sex and gender. How? Well, the companies could have a tax break, for example. And we really need to push so that this can become a benchmark for the future, because the way it has played and the way it is playing is truly disrespectful of diversity. Thank you.
Thank you to all our wonderful panelists. I think there are a couple of key takeaways from what we've heard today. One is that gender and sex disaggregated data really ought to be the default. That should be standardized across our data collection efforts, but that there's more than just sex disaggregation, and going beyond that is going to be essential, looking at dimensions that where women are more vulnerable or are disproportionately affected, whether that's reproductive coercion, as Abhishek mentioned from India, or whether that's violence against women, as Papa mentioned, or unpaid care work or mental health. These are issues that should also be covered in our statistical and data collection efforts. With that, I will now request all the panelists to put on your cameras, as we have received a few questions from the audience, and I would encourage the audience to share further questions. We have a good 10-15 minutes to actually discuss amongst us the kinds of questions that we have received today. The first question is for Papa Sek. To measure violence against women through big data, would that be a possibility? And what would be the main challenges? And after Papa, I would also invite Anita to weigh in on that, and anyone else who wants to jump in, given that many of you have thought about big data and violence against women. Papa, over to you. Papa, I think you're on mute. We can't hear you.
Yes, sorry about that. I was indeed on mute. So we've used big data to measure, to get a proxy information on violence against women-related trends. So, for instance, UN Women has partnered with Quilt AI and UNFPA to conduct analysis of big data in 8 countries: Bangladesh, India, Indonesia, Malaysia, Nepal, Thailand, and the Philippines and Singapore. The analysis identified trends from discussions on discourse data generated through social media platforms and search engines. And really, I think it really showed people's search behaviors on violence against women-related topics, both before and the onset of the pandemic. And you can find the results on our website at data.unwomen.org. I guess the question here is that there are, of course, things that can be measured through big data and things that cannot be measured. So, for instance, you cannot measure prevalence of violence against women just through big data, because the data, of course, will be biased to those who are who have access to the internet, or who have access to social media platforms and so on. So there are, of course, again, big data can be useful, but it depends also just on the type of information that you're looking for. But it is definitely possible.
Anita, would you like to weigh in next on the big data and violence question?
Sure. I mean, I absolutely concur with Papa. We also have done some work around the social media platforms. We typically will describe the indications of this as misogyny And so we have a brief on that on the Data2X platform that looks at misogyny and a rise in misogyny at certain points during the pandemic as well. I think there's also certain types of violence that may be more amenable. I think, as Papa said, it can be direct experiences, for example, of partner violence can be really difficult to detect, or a sexual assault. But I think that in some ways, capturing some of the aspects of violence against women in politics or sexual exploitation, there may be ways that are very, frankly, difficult to be able to capture easily. Sometimes it's a way for us to be able to assess it via big data when we don't have these surveys out there that can capture the information. Thanks.
I'd like to weigh in too. Just one point.
Amy and then Linda after.
Okay,
so,
sorry.
You go ahead.
So one point that Anita raised that I think is really worth considering is the use of these proxy measures that may be less biased in their availability. Of course, that depends on reporting of some of these incidents, but this is a really nice measure. As Papa noted, we do have to worry about the biases around social media, not just access, but also, as Jessamine noted in the Whova chat, some people may not choose to report or to blog about such things. They may feel like that's something they should hide. And so it's very difficult to understand in a big data source all the many different sources of biases, but we do have good data on the people who choose to respond.
Thanks. And Linda, would you like to go next?
Yes. Yes, I think the best way to measure violence against women are not big data, but surveys. This is very important because only through surveys on women it's possible, and we can have the measure of hidden violence against women and all kind of violence against women. We can have additional information through big data, but the best source is Violence Against Women survey.
Great. So I think the conclusion from this discussion is that, yes, it's possible to use big data to measure violence against women, albeit with some bias, but the go-to measures should really be based on population surveys for gender-based violence. So it's an addition and not a substitute. We have another question that's related, and I'll direct this first to Amy and then ask others to weigh in as well, though I know we have limited time. The question is, I agree that the collection of sex gender data is important to control for biases, but should we not also emphasize the importance of stratifying our analyses by sex and gender to better understand important differences? So actually talking about stratification. Over to you, Amy.
Yes, so that's the short answer is yes, that's an excellent point. We would ideally like to be able to look and see whether associations we're interested in actually operate in a different manner according to biological sex or different categories of gender. And that's an important distinction versus just simple control of sex or gender as a confounder or potential source of variability. So yes, I agree. Looking for effect measure modification and stratification are very important.
Can I chime in on this?
Sure, go ahead.
So I totally agree. And I also think that we can't. So I'm in California. We've been doing data collection in California, and California is an environment that is relatively more supportive of people that are beyond, that aren't adhering or not within the gender binary. But even for us, when we try to get these data with a state representative sample, the numbers are really small. So yes, absolutely. But I think one of the struggles we have is that when we simply try to collect the data through population-based surveys, the numbers are just not sufficient to do those analyses. And so it really does take working to do other types of survey data collection. And it may not be possible in some countries, but even in countries where that might be possible, you're going to have to figure out other ways to do data collection rather than just your standard population-based survey to be able to get the numbers. And that's going to breed some bias, yes, but you can't just go in and do a population-based survey in most contexts, I think, and be able to get the numbers you need to do those analyses.
So stratification often comes with additional resourcing needs, which is an important question around financing. So we are on to our last question, and I'd like our panelists in general to weigh in on this. It's directed at Papa, but I think all of you have important things to add to this. This is around the extent of gender biases you have observed in the data collection that you have undertaken. So not only in the rapid gender assessment surveys during the pandemic, which UN Women led, which the person asking the question is directed to, but it'd be useful to understand the kinds and extent of gender biases you have observed, and if there are ways you have found to address these specifically. So anyone like to go first?
Yeah, happy to go first.
Sure, go ahead, Papa.
Yeah, no. Thanks very much for the question, Karen. I mean, for the RGAs on violence against women, it was only asked for of women. So these were surveys just done for women for safety reasons, of course, just making sure that we didn't put women in danger. And but during the screening process, we found that there were large screen outs for male, which translate to how women have access to phones, right? So I think basically one of the first challenges that we had in terms of biases is really the fact that we were using people who had mobile phones, and there were all kinds of challenges when it comes to, for instance, reaching age groups of women 60 plus, for instance. But also, just I think in terms of ownership of mobile phones, I think in a lot of ways are correlated with also, the socio-economic status of the socio-economic status in countries. So this is, I think, something that we are seeing in all the RGAs that we are doing. We try to address them to the extent possible by oversampling and really making sure that we have quotas that we try to meet at the country level, but it hasn't been really easy. So one thing that we aim to do going forward is really also just using the results of the RGAs, and in a few countries, now that countries are opening up, conducting regular surveys and really, cross-checking the results to see exactly where the biases are coming from. So it is still a learning process for us as well.
Thanks, Papa. Abhishek, would you like to weigh in, Abhishek Damaso, on this question around gender biases in surveys?
Hi, Diva. I think I can talk about the experience that I have from the Indian surveys, particularly the National Family Health Surveys. So in those surveys, I have not particularly found any biases, in the survey, because we already have a lot of indicators of, lot of gender indicators in the survey, and we do all efforts to collect these data to the highest quality. And we do a lot of rigorous training, and we do a lot of introspection also. And it is mostly the female respondent interviewers who collect those data. And at times, they were also in India, collecting sometimes the information on violence against women and sexual behavior. They are sensitive in nature, and sometimes we feel that it would be very difficult for the women to respond. But my experience is that when we, in particular, when we go to the field in India, probably these surveys like NFHS offer the first opportunity to the women to share actually what has happened with her. Because, in India, the women live in their, marital homes, which is sometimes far, far away from their natal homes. And, instead of relying or sharing these episodes with the family members, or the neighbors, they would love to share it with an outsider who is an outsider of the community. And that's why that's where there is less risk, like just now Papa said. So we have seen that NFHS kind of surveys in India actually provide a very good and first opportunity to the women to respond to these questions. And, we have also looked at some of the data, and then we find that the biases, particularly the biases, are relatively lower in the Indian data compared to the data that comes from many other countries. Thank you.
New perspective and insight from India, from Abhishek. And Linda, you look like you want to come in.
Yes, we use, for example, mixed mood survey to consider all kind of people, all kind of women to Kawi, Kapi, Kati together. And the other thing is we analyze the characteristics of women and the people who don't respond and consider models to check and correct the bias.
Thank you. And Linda, that was very to the point. We only have a minute left. Is there any other panelists who'd like to come in? Sarah, I can see you as well. So the last minute is yours.
Yeah, thanks, Diva. It's less about a gender bias than a reporting bias. So because we're analysing at the global level, our data is very much influenced by the countries that consistently report sex-disaggregated data. So it's about the absence of having something structural in the system that requires and mandates sex-disaggregated data to be reported. That means that you end up with a global picture that is biased by those countries that will consistently be doing it. And what we've found is that the consistency of reporting correlates with the income level of the country. It's high-income countries that are reporting sex-disaggregated data more consistently. So our understanding of the impact of sex and gender in low and middle-income countries diminishes because they're not consistently reporting.
I guess the question is that resourcing, since, that's something that's come up in the chat, or is that capacity, or is it just motivation and mandate, right? So it's something to unravel.
A good question. I don't know. I mean, part of it, we see countries that report once and then don't report again. So part of me suspects that it's the absence of a system requirement rather than, people aren't thinking of it, so they don't do it.
Great. Thank you so much to all our panelists for this wonderful discussion. If there are any last pressing thoughts that you would like to share for the discussion, I would invite you, especially Ilaria Damaso, we haven't heard from you. If there's anything you'd like to jump in and say, now is the time. Otherwise, please, to all our viewers, thank you for joining this wonderful conversation. Please feel free to reach out. I see Papa has raised his hand, and Papa, I give you the floor for the last 30 seconds that we have remaining.
Yeah, no, I think thanks very much, Diva. And this was really, I think, a fascinating conversation. I think, again, for us, just one point that I emphasized in my presentation, which is, really, I think, moving from data production to data use. And, this is, I think, what will probably move the needle for us. Really, serving not only to demonstrate the value of gender data, but also, ultimately to change women's lives.
We had a question from one of the viewers who was asking on how could we use data to, push progress on gender equality, even if governments are going in the opposite direction. And I think that point is key, as Papa was noting, to ensure that the measurement challenges, the data gaps that you're filling at the end of the day actually make their way into policies. And similarly, we actually have policies that mandate not only sex-disaggregated data collection, but also cover areas that are important to women, whether it's violence or unpaid care work through time use or GBV surveys, areas that are actually important to continue measuring and allocate financing to, even as we explore new tools such as big data or other innovations to fill in those data gaps. I wanted to thank you all for taking the time today to join this discussion with a wide array of experts from different countries. So many thanks for joining in for this conversation, as well to our audience who was actively engaging with questions, please feel free also to respond to the Q&A on the Whova page for the UN World Data Forum.
Thank you.